I'd like to invite you to actually follow this presentation live right now from your phones, from your laptops. You can actually comment throughout the whole conversation. So that's bit.ly, Future of Public Health. I'm trying to get my there. So today I'll be talking to you about the European context, like how are young professionals in the EU region actively involved, and also I'll be putting my own take on the future of public health from a technology point of view. So I'll start off with the European context. There was meant to be an emoji there, but somehow it just didn't work out. I'm sorry about that. And so, when it comes to the EU and the public health young professionals, we have three main outlets. We have WFPHA Next, which is a branch of WFPHA, the European Public Health Association. We have Euronet MRPH, which is the European Network on Medical Residence and Public Health, and we have Young Forum Gastein. So WFPHA Next, as you can see, is part of WFPHA, and it really truly defines young professionals as all students, early career researchers, and professionals. So it's not restricted to just one profession, such as the medical profession, but it's actually open-minded and open for everyone. It has about 1,420 members, so it's quite an extensive network, and it has three main pillars. That is networking, collaborations, and pretty much strengthening presence of young professionals in public health, especially in the European region. Then there is Euronet, MRPH, as I said before, the European Network of Medical Residence and Public Health. And actually, I want to point out something very interesting. I'd really like to encourage all young professionals here to set up their own associations. So the Australians, please set up one. You know, I mean, I'm really looking forward for you to take leadership in that aspect. The Americas, Canada have started, the European Union states, we have started as well. Africa, please, I want to listen from you guys as well. We have a lot to contribute and a lot to bring forward. So, just a quick idea. So it comprises solely of medical residents in public health, so physicians who decided to specialize in public health in the European region. There are 11 countries represented. There are 9 full and 2 individual members. And basically, it's a network of European national associations of public health training programs, including medical and non-medical residents. So then there's Young Gasteiners. There's the European Health Forum Gastein. And as you can see, there are the links if you want to have a look at them later. And what they're focusing on is basically surrounded and centered on the actual event itself. It's a yearly event, European Health Forum Gastein, and there is an opportunity over there to actually bring together different people from all over Europe to actually have a direct role in policy making. Now, there's an application process in all of this, and there are specific requirements. So you have to be in a specific age group, you need 2 years of experience, but that shouldn't stop you. So there's an application process, so if you're within the European Union, please just fill it up and see what happens. You never know. The worst that could happen, actually, they just tell you no. Try again, try again, try again. That's the message I want to bring across here. And it's mostly focused on networking opportunities. There's policy making and actually special access to closed sessions. So if, for example, you get to be chosen, you actually will have the opportunity to be able to access specific policy-making sessions, which are usually closed. So here you have a chance to put your voice ahead. Then there is the aspect that you would be actively working with the European Health Forum Gastein, which is an extremely active community, and is bringing forward lots of important. That means that you will be on the same table with ministers of health from around Europe. I hope this initiative is actually taken to other countries, really, because I think that's quite cool. And the European Health Forum Gastein is not just a conference, it's not related to just one event, but it's actually a year-long commitment. And it's open to EU member states and countries which are in the European Free Trade Association. So we'll go a bit back up. This is a bit of a dynamic presentation. And we'll go back and talk about the future of public health. I want to point something out. Our job in the next 15 years, and that's where the futurist tendencies come here, will be totally different. It will be totally unrecognizable. That means we won't be sitting on laptops writing reports all day long. We won't be actually dealing with Excel spreadsheets and having to figure out the data, how it is going to bring the... We'll actually have artificial intelligence supporting what we're already doing. And as a result of that, we'll spend less time dealing with the data, actually thinking up what words we're going to say, and more on the high-level thinking. And that's where we're going to have a role. And what I'm going to invite you to, I'm going to give you some technologies which are available for us right now, today, and I'm giving you some thoughts about them and see how it will change public health. So why bother? Exponential technologies. When I'm talking about exponential technologies, I'm talking about those technologies where each year the power and/or speed are doubling, and the cost is dropping in half. That means that a microprocessor 20 years ago used to cost 10 times more than it costs today, and it's 10 times faster. So imagine the computer, our smartphone, which we have right now, is used to fit in a room maybe which is this big. So it used to be such a big thing, and now it's so compressed. So that is one thing that I would like to invite you to. I'd like to apologize that I didn't acknowledge the founders of this land, current, past, and future, and I'm really grateful for the Wurundjeri people to actually give us the opportunity to be here today. Apologies from my side for not mentioning before. Artificial intelligence and machine learning. As you know, when you talk about artificial intelligence, we're talking not just about like an electronic brain, but in reality it is. We're also talking about the fact that there are algorithms which are designed by people, supported by machine learning. What do I understand by machine learning? It might be like some complex term, but actually what it means is that you have set up algorithms in place for detecting errors and learning from them. So actually, machine learning is also supported by human input. And that means that, for example, if there is an algorithm, let's say, that's for doing stakeholder alignment, okay, to see like what influences, and you know, like, listen, this is not actually in place, this needs to be changed. What you do then, you teach the system, like, listen, next time this should be placed in this part of the map. And over a period of time, the system itself gets more and more intelligent. And as a result, it will reduce the number of errors. Isn't that better? Quantum computing. I'll give you a bit of sense of, like a side of humor here, and I couldn't resist but sharing a video of Justin Trudeau actually explaining what quantum computing is all about. I'll let him do the talking here.
I was going to ask you to explain quantum computing, but when do you expect Canada's ISIL mission to begin again, and are we not doing anything in the interim while we prepare?
Okay. Very simply, normal computers work by... No, don't interrupt me. When you walk out of here, you will know more. Well, no, some of you will know far less about quantum computing, but most of you, normal computers work either there's power going through a wire or not. It's 1 or a 0. They're binary systems. What quantum states allow for is much more complex information to be encoded into a single bit. Regular computer bit is either a 1 or a 0, on or off. A quantum state can be much more complex than that because, as we know, things can be both particle and wave at the same times, and the uncertainty around quantum states allows us to encode more information into a much smaller computer. So that's what's exciting about quantum computing.
So as much as Justin Trudeau is excited about quantum computing, so am I. And one of the main things about quantum computing, which I would like to highlight here, is the fact that computers are going to get better and better. And I think that we should embrace the opportunity and lead within public health with regards to adoption of technology. It seems that public health, somehow, we really struggle with this. And it's not just in my country, it's everywhere, really and truly. And the fact that we have this opportunity today, and that's why I'm talking to you about it, because I'm inviting you to actually rethink the way you do things here. And quantum computing might be a very interesting way, actually, to process enormous amounts of data from different sources and bring them into one place and making sense out of them. so that we can take better policy decision making. Yeah, apologies. Another interesting thing, this is 3D printing here, and maybe it's not directly related to public health, but what about, for example, building 3D printed models to rethink the way we do urban planning? Or what about doing 3D models to actually be able to analyze environmental hazards and seeing and assessing? So this is just the start. And even, for example, you might be using things on the field, for example, something which might replace, and we would say, all right, let's 3D print it. So that's also a thought for you. And actually, when talking about 3D printing, we're also thinking about bioprinting, and how will that change our policy? Will we start funding bioprinting? That's also a thought. It's expensive right now. Another thing that I want you to think about is the virtual and augmented reality. So here what we're going to do, we're seeing zebra imaging technologies, and you can see literally a kind of a hologram. Wouldn't you imagine this being very useful in emergency preparedness, where you actually be analyzing from the top-down approach, and we'll be analyzing with a team of people surrounding this table, and actually start saying, all right, we have to be there, and start planning. Also, what I found very interesting as well is what Microsoft is doing with HoloLens. I couldn't resist, of course, sharing this video, but I'll try.
We've been teaching Reserve University. We are
go apart and show
on top of the skeleton.
So as you can see over there, literally they're wearing HoloLens, and you have the whole visualization over there. The future in reality is, the hope is in augmented reality, and augmented reality means that it's another layer on the existing reality that you have right in front of you. So it's not a change, but it's something there, and you can actually interact with it. For all those who are medical students, doesn't medical school look better this way? Yeah. So that's one thing, yep, sorry. Battery technology. When I think about battery technology, we're thinking about the fact that right now we're carrying around power banks with us where the battery is not lasting even a full day. But think about it, you have an impressive computer in your hand right now, which is covering six or seven products. You have an MP3 player, you have a camera, you have a video camera, you have a 3D camera, and sometimes you even have a note-taking application, you have a PDA, you have all those different things. You have a music player. So what are we doing with this? And even more relevant to the healthcare sector, we're actually having something which actually measures your vitals. Think about that. And how it will affect field epidemiology, for example. You will have a smartphone which will be able to analyze on-site data, actually on the device. You'll be able to analyze and actually be able to come up with insights there and then. The insights which used to take months sometimes to analyze before. Blockchain. Blockchain is an impressive technology. You've heard quite a lot of bad rap on blockchain, but what is really bringing out blockchain is the future of audited contracts. That means that if a contract is signed and you want to know who signed that contract, it won't be covered by a veil of secrecy, but actually you will be able to go back to that transaction and be able to see who exactly signed that transaction. And then the blockchain technology is not just about the money and about Bitcoin, but it's about the technology securing transaction. So we have also a new transactional currency. And this transactional element of all of this will help us be more transparent than ever. As public health professionals, we're seeking to be extremely transparent, and we want politicians' actions to be audited. And this is one technology that we should use, and we should actually advocate to implement. Just to let you know, actually it's already implemented in Estonia. So this is something to think about. So something just to sum up what we've gone through so far. Artificial machine learning, quantum computing, 3D printing, virtual and augmented reality, blockchain, battery technology, and this is just the start in reality. We have nanotechnology, we have public health genomics. Really, the future is endless. For example, with genomics, we can even, for example, do policy making, and we will be able to plan What are the healthcare needs? What do we need to put our money in? Do we need to put our money more in the diabetes-related diseases, or do we need to put it in more cardioproductive measures? So that's a thought. So what I would like to invite you today to bring about a conclusion, like, please, everyone, from young to old, like proverbial, like the physical old, because inside I'm sure that you're full of energy and jumping around and wanting to. When I see, for example, Adrian, I get inspired, and I get even more energy. So really and truly, you're all young in spirit. And I invite you here today to get ready for the future and embrace young professionals. But more than this, challenge them. And how do we challenge? I want you to go back and reflect. How can we do this faster? How can we do this better? Do our methods, existing methods, really answer the question? And do they answer the question faster? In a Trump era of politics, we need to think about how to take quicker decisions, faster decisions, to come up with evidence even quicker, so that we're there, we anticipate, we're not late. And technology can help us get there. So I'd like to thank you. And I'll also let Morgan Freeman do the thanking for you. And last but not least, because now we're going to start a bit more of the interactive session, there is this QR code, and within this QR code, which you'll be able to scan with your phones, hopefully it's big enough to scan, I'd like to invite you to sign up to our mailing list. So this will be a way to connect with you, and at the same time, it will be a way to try to create this engaging discussion and bringing forward. So, yeah, that's about it. Thank you, everyone.